working in the spirit of the Golden Empire. Now, from Kern Golden Empire Television, 17 News at 5.
And still to come here on 17 News at 5, freighting facelifts, sagging skin, health scares, even death. It's the price some people pay for botched beautifying surgeries. Tonight, our Melissa Knievel looks at the uglier side of plastic surgery.
And medical news tonight and a special report everywhere you look practically. You can find it to TV shows, celebrities, magazine ads. We're talking about plastic surgery.
And more people are choosing to go under the knife despite the risk of complications. 17's Melissa Knievel is in studio with more on the uglier side of the beauty business.
Robin, 11 million people had plastic surgery procedures last year, and they were performed here in the United States. But all too often, those surgeries to make you more beautiful turn out just the opposite. Sloppy liposuction, terrifying tummy tucks, laser resurfacing scars, and botched breast augmentations are on the rise. The search for beauty is prompting more women than ever before to take the plastic surgery plunge for poutier lips, bigger breasts, leaner thighs, or a flatter stomach. But one local woman says, be careful what you wish for.
I looked in the yellow pages. I made the appointment for the consult. The next week I had my surgery.
27-year-old Glenda Belangia wanted to change her bra size from an A cup to a C cup, but she says a local plastic surgeon stretched her skin so tight the stitches never healed.
I couldn't lift my arm past this, and it would just rip right back open. So I had to go on disability.
And the open wounds led to a horrible infection.
I was on several antibiotics and I got immune to them, and he eventually had to put a tube in my left breast. Okay. The tube was on the side right here. It was on the side right here, came down, and there was a vial that the infection drained into. The scar was underneath right here, but it was probably about that thick, and it was deep too.
Because of legal reasons, Belangia does not want to name the local plastic surgeon, but she claims her doctor's idea of a cure was to keep redoing her breast augmentation.
I would cry myself to sleep almost every night and know that I had to go back and see this creature.
Belangia says the doctor redid her surgery more than 8 times within a matter of months. So frequently, she says, she became immune to the anesthesia.
He would drain the bag, pull it out, throw another one back in, and just start stitching away. And I mean, I literally saw his hand going like that.
She eventually went to local board-certified plastic and reconstructive surgeon, Dr. Darshan Shah. He says Belangia is not alone. Cosmetic surgery problems are on the rise.
Plastic surgeons across the country are dealing with this on a daily basis, and there are some plastic surgeons that make their entire career fixing these types of issues that occur at people who are not trained coming to them.
Former cosmetic surgery professor Dr. Brett Lahaki says when it comes to going under the knife, it's buyer beware.
The public needs to understand about cosmetic surgery is that for all intents and purposes is really quite unregulated, and so anybody who has an MD after their name can really do anything they want legally.
Some doctors are in fact learning how to do tummy tucks and breast augmentations, which are very invasive plastic surgery procedures, just from a weekend course or having someone come teach them at their office. This is not the proper way to learn plastic surgery.
And patients pay the price in more ways than one.
I saw quite a few people have implants coming out of their body because they weren't properly inserted. I've had a lot of people come in with large areas of their body necrosing and infected because they went somewhere to do a tummy tuck where they took too much skin off.
Here's one way you can avoid a plastic surgery disaster. Go online and check the Medical Board of California and also the American Board of Plastic Surgery. And ask your doctor questions if he's had any complications or deaths in surgery. He's obligated to answer you truthfully. Mother of 3, Jerice Peralt, says she asked those questions when she went in for a tummy tuck and a breast lift last year, but she was still left hospitalized 3 weeks after the surgery.
I want to say it felt to me like a flesh-eating disease. It just seemed like it was eating away. In the morning, I would notice on the incision a little opening, and then as the day went on, the opening would get bigger and bigger.
Doctors told her she'd contracted MRSA, now known as the superbug, a staph infection immune to antibiotics.
There was days where, if it weren't for my husband, I probably wouldn't have even got out of bed because I was so sick of looking. I had to get up every morning. The first thing I had to do was take off all the bandages, and just seeing it made me just, it was gross and it was on me.
It took almost a year for her incisions to heal, and for both Peralt's and Glenda Belangia, their perspectives on plastic surgery have changed. Today, following Belangia's last reconstructive surgery, she's happy with the results, but she will continue to warn others about going under the knife for beauty.
Definitely do your research. Definitely know that it's the type of procedure that you want, because you can never turn it back and turn back on what they've done.
For a plastic surgeon to be certified by the American Board of Plastic Surgery, they must have completed a proper plastic surgery training course. Also, some doctors may still be certified by the Board of Plastic Surgery, but have lost their actual medical license. Check for that too. And if you feel you've been a victim of plastic surgery that's botched, talk to the Medical Board of California about it. And for more information on how to check your doctor's credentials, log on to our website at kget.com and click on the hot link button. Jim.
All right. Thank you, Melissa. Still much more ahead here on 17 News at 5. Holiday travel trouble.